Hey everybody, welcome to the module looking at biomechanics and motor control and behavior. Again, my name is Dr. Nick Murray, and today we're going to talk about kind of this application aspect and what you're going to be going through today. Primarily when we consider the realm of biomechanics, we are interested in human movement and what are the forces acting on the body during that human movement? What is the stress acting on those bodies? What happens when you throw a baseball pitch? What happens when you swing a golf club? What happens when you run? All these things are important questions looking at biomechanics, and particularly in the sport biomechanics realm. If we were to look at that as a whole, we want to understand that there's been a great deal of work done in biomechanics over the past 100 years or so, but really the forefront has really become more prevalent since the 70s and 80s, I would say. With the more advances in technology, we can more effectively measure biomechanics using novel and new technology. A prime example that I like to give everyone, if you've ever seen the movie Avatar, or Star Wars, or anything that has to do with computer-generated graphics or CGI. You're looking at essentially someone sitting in a motion capture lab that they're analyzing that human structure, and you actually have an actor behind that CGI graphics. What makes it so important is that you get real-life movements and structures that can mimic and be projected onto a cartoon or a digital image. All of that encapsulates the true nature of the individual, and it provides them with a real perspective, and it makes it look more realistic. So why is that even important? Why do we care? Honestly, at the end of the day, we are really interested in biomechanics in sports performance and injury prevention and the theories behind how the brain controls that movements. And that's where we kind of have the motor control and behavior piece that kind of aids to biomechanics. Now, don't get me wrong, there's two separate domains here when we talk about biomechanics and motor control. However, they do exist in the same realm, and I almost go as far as to say you cannot have one without the other. You cannot have motor control without biomechanics, and you cannot have biomechanics without motor control. That's why we see a lot of folks who work at universities and do research in these areas combine the two. My area and my specialty when we examine biomechanics and motor control is from a brain perspective. I'm interested in seeing what happens up here and how it influences the rest of your body. For example, someone who has a concussion, we haven't really talked about this much, but I've done a great deal of work and research in concussion throughout the country. If you have a concussion or you have something that impacts the brain, how does your body respond? How do you move? Well, we measure that biomechanically. We take a look at the human posture system. We look at how well they're able to maintain their human movement, biomechanics, and those forces that we can measure relating to that human movement, biomechanics, and then relate it back to how the brain is controlling that movement, motor control. So in short, when we look at these unique realms, we can look at all different facets of human movement that also span into engineering and microbiology at times. But for the most part in health and kinesiology, what we're interested in is sports performance and injury prevention. Those two fields are very profitable, obviously, and they tell us a great deal about the human system. So when we are going through this module, keep in mind that you have these different fields that are synergistic that really can't exist without one another. And so a lot of the folks that you'll watch in these videos have similar disciplines, similar backgrounds, and that they all are taking little pieces of the puzzle. Certain people are looking at robotic motion, and how robots learn. Well, that's all mimic and based off human movement and human performance. So they have to study human models first in order to apply it to robotic models. Why would we need that? Well, there's a lot of robots that are used for surgery, that are used for menial tasks that a human arm or hand would be potentially unsteady. But the robot has to learn and has to know how to do that human motion. And so that's why they take a look at the actual individual and the human itself first, measure them, and then apply it to the robot. In sports and injury prevention, we're really concerned with making sure our athletes are healthy and how do we maximize their potential. Biomechanics does that all the time. If you look at the different ways that we can throw a baseball pitch, that's been analyzed and said, well, if you throw it this certain way, at this certain angle, at this certain velocity, you're going to maximize your potential for the speed of the ball. Now, with that, maybe we might consider the risks. If you do a sidearm pitch versus an overarm pitch, what does the effect that it have on your elbow? This specific ligament here, this ulnar collateral ligament, is typically damaged in pitchers. Well, we might be maximizing the velocity of the pitch and the speed of the ball. However, we could damage that particular ligament. And that's very problematic, and we need to consider those injuries. But those don't always come around because sometimes then we get an injury, and then we go, wow, that's really interesting. Let's take a look at that further. Just like with brain injury and concussion in my area, we need to take a look at that further. So hopefully you'll enjoy some of this information and go through it. Be careful as you're going through it. Make sure you're paying attention to it because this is a very broad and wide field that has a lot of different applications. And I would say to you for career paths, if you really like mechanics, you like physics, this is a really good field for you. If you like computers, if you like dealing with new and novel equipment, and also pairing clinical sides of that, injury prevention and sports performance, all of those encapsulated together really make up the field of biomechanics. And there's a lot of jobs in biomechanics. Biomechanics is an incredibly viable field where you have gait labs, that's walking and running. You have gait labs that exist all over the country for analyzing human movement in disabled patients, in pre and post-op surgical interventions. Cleveland Clinic, Shepherd Center, all these places have gait labs that are run by folks like me, biomechanists, who are trained in analyzing the human movement system. And we do it not just looking at them, just like a physical therapist would say, oh, you might have a deficiency here. We quantitatively measure them and apply numbers to those. And that's what makes the field of biomechanics so robust, is because of the actual measurement of true data points. So enjoy. I hope you learn a lot, and let me know if you have questions.